Good evening to all. The 43rd medical term is on the organ kidney. So, what is this kidney? Of course, as we all know, it's a pair of organs. There's two bean shaped organs at the back of the abdomen, below the rib cage at each side of the spine. So, that's the exactly location of this pair of kidneys. So, what is the size of this? Well, it is size of a fist. So normally we use this terminology even for the heart, right? So indicating a very smaller structure. And why do we need this kidney? Because it needs to filter the blood or to filter the waste or remove the waste from the blood. So if you look at the functions, overall functions of the kidney, so we have around six main functions. That is, first one, obviously the waste removal. The waste substance can be urea, creatinine, or even toxins, right? And that is all collected in the form of a urine. And by releasing these waste through urine, and the urine is consists of the water, isn't it? So it is able to maintain the fluid balance by excreting the excess water. And while we are excreting water, electrolytes like sodium, potassium, calcium, phosphate is also either they are brought back to the blood, or if there's excess, they are sent out. So electrolyte regulation is also maintained. Apart from that, the blood pressure is controlled because the kidneys are able to produce a hormone called renin, which is responsible for vasoconstriction. And apart from that, the kidney also serves as a hormone or like an endocrine organ by producing erythropoietin as well as calcitriol. At the same time, it also maintains H plus and bicarbonate ions, so therefore it is an acid base balancing organ as well. So overall, if you look at the anatomy, as you can see, it's a bean shape. Two regions are there, the cortex and the medulla. So we have the renal artery bringing the blood with the waste, and as it enters the kidney, the nephrons filter the waste or remove the waste, and the remaining blood is sent back to the renal vein. So the nephron, which is the fundamental or the structural unit of the kidney, has certain regions like the glomerulus, capillaries inside Bowman's capsule, followed by the proximal convoluted tubule, then the loop of Henle, then the distal convoluted tubule, and ending up with the collecting duct. So all these collecting ducts join together into the kidney to form the ureter. So mainly urine is excreted by filtration, reabsorption, and secretion.